Reopening our hotel safely. I'm sure many of you all have concerns and questions regarding our hotel with the whole chaotic COVID-19. At the end of 2019, the first case of COVID-19 was found in Wuhan, China, which caused shortness of breath and fever. COVID-19 is passed on from person to person, therefore, wherever there's people, you can potentially get infected, or affected. They could be transmitted through daily activities when coughing, sneezing, talking, or even breathing. Breathing the same air as someone who has it can spread the disease because COVID-19 particles can live in the air. COVID-19 particles can also be on hard surfaces, possibly after someone touching the surfaces after sneezing or coughing. This slide shows some of the common concerns of public spaces such as hotels. Were you one of those people who didn't trust public areas because you weren't sure about the thoroughness of the cleaning and sanitizing procedures? You didn't know how well trained each of the employees were with the new health protocols due to the COVID-19 pandemic? Too many people that might have touched the food that you are eating at restaurants and bars? Afraid of COVID-19 transmission through shared space, hard surfaces such as elevators, vending machines, gyms, and doors? You saw the COVID-19 issues and how they spread. How does a hotel open up safely? There is no need to worry because our hotel knows public COVID-19 concerns. We follow health protocols and guidelines, and guest safety is our number one priority. These are the ways we keep our guests safe. To prevent transmission of the disease and implement protective steps. Face masks are required in all indoor public areas. When people line up, there will be also directions on how to keep a 6 feet physical distance to avoid contact with those who are sick. Keeping hands clean. Washing hands with soap and water for 20 seconds is preferred method for washing away any viruses on hands. If there's no immediate access to water and soap, the hotel places sanitizer dispensers at entrances and contact areas. The dispensers are in every common space you can think of, including reception areas, lobbies, restaurants, meeting spaces, and pools. The sanitizer dispensers are touchless and have at least 60% alcohol. With the easy access to alcohol sanitizing, more people in public should feel safe and maintaining their hands clean. Employees are required to wear gloves and when cleaning guest rooms and changing them when switching rooms. Cleaning and disinfecting protocols. The hotel is serious about maintaining clean surfaces. We use 70% alcohol solutions or EPA-approved disinfectants for maximum effectiveness when cleaning public spaces. We teach our employees that EPA-approved disinfectants are to kill the germs and to decrease the amount of viruses on hands and touched areas. Washing hands with soap and water is the most effective. Surfaces that are touched by multiple people, such as front desk, ATMs, escalators, handrails, and gym equipment, are disinfected daily. This step will ensure our guests to stay safe. Guest room items wherever guests could touch are disinfected daily as well. These areas include remote controls, toilet seats, handles, doors, telephones, light switches, and temperature controls. Housekeeping staff are required to enter guest's room 15 minutes after the guest had left for air exchange. Housing staff will throw away all single-use items that are left in the room. Safety in food and beverage. There will be no traditional buffet services to decrease the chances of people contacting shared food. Food will be served by servers wearing protection gears, including cloth face masks and gloves. To avoid having used utensils on the dining tables for too long, attendants are required to switch them to new sets frequently. In order to prevent food being exposed in public air for too long, each dish is served in smaller portions. Sneeze and cough screens are on food before serving guests so that they will be protected by potential viruses. Guest checklist. These are 5 guest and employee checklists that we heavily emphasize to everyone associated with our hotel. The guest checklists will be informed to the public in a variety of methods. They will be placed on areas where guests will be able to read them. For employees, the checklist will be taught during training and employee meetings. For guests, the checklist will be placed on room doors, front desks, and communal areas. The first and the most important one is making sure everyone is wearing a mask. With face covering, social distancing will also be implemented, which is at least 6 feet. If a staff notice someone lining up and seems too close to the next guest, a staff will warn them. The second checklist item is utilizing contactless options as much as possible. This includes online reservations, check-ins, and payments. Even without COVID-19, these options are faster and more convenient. Daily room cleaning is emphasized as well. When guests leave, rooms are cleaned thoroughly 15 minutes after guests have left. If the room was not occupied by any guests, the floors are still vacuumed. Service delivery is done in a safe way that eliminates guests and employee contacts. The guest will be notified electronically when their service has arrived. And refraining from traveling when ill is one of the most important guest checklists as well. This is an example of how our posters look like to remind our guests and employees about the safety protocols. So, social distance at 6 feet apart. When in public, wear a mask. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with a tissue or use your elbow. Put tissues in the trash bin and wash hands. Wash hands with water, soap, sanitizer at least 20 seconds. Avoid gathering in groups. Do not share eating utensils and food. If you become sick, seek medical care immediately. I hope this presentation convinced and made you feel that our hotel is back to business with just a few adjustments to keep guests safe. And here's the works cited. Thank you for your attention.